I'm with Dr. Trish Burgess from America, and we're here at Bethlehem Bible College. Now, Dr. Trish, what are you doing here at Bethlehem?
This is a team from Global Health Outreach, and we're running the general medical and dental clinic taking care of patients here in Palestine.
And how many people have came here with you from the U.S.?
There are 19 on our team. We've got a big dental team of 5, and then we have several doctors, nurses, pharmacists, and some non-medical servants who help in things that we're busy taking care of patients, so they do other things like give reading eyeglasses or just help with patient flow.
And what sort of people have been coming on your team? Who have you got on the team?
We've got all kinds of doctors. A lot of them are general or family practice, but we have specialty doctors. Here we have an orthopedic surgeon, and we have a doctor that does joint injections. We have a dermatologist here, and it can vary. Sometimes we'll have other specialists. A lot of times it's just general. And then we have dentists. Some will do what we call restorative, or do like fillings or fixing teeth, and then the others will just pull teeth. You know, if we're really busy like in an Africa country and there's hundreds out there, we'll just pull bad teeth just to give them some longevity as far as their mouth goes. And then we'll do specialty trips too, like human trafficking, where we take care of prostitutes in certain areas. We do orphan care missions. So there's a variety of people on the teams.
Now, you're here in Bethlehem. What sort of people have been coming in to see you?
We've been seeing, of course, the poor, the Palestinians. We've been seeing some of the refugees in the area, but those basically who have little to no access to health care and don't have the money to go or follow up.
Are you finding there's a lot of poverty here?
Yes, there is. We've certainly seen poorer areas, and we're going to a tent, or not a tent, but a refugee area tomorrow where they're supposed to be even poorer. But yeah, we mostly are seeing that's what we want to do. We want to reach the least, the last, and the lost. We want to reach those that don't have access. We've seen quite a few special needs, children and adults, and just loving on them, caring for them, cleaning their teeth sometimes, or taking care of other dental needs, and then just general checkups.
So you're not just set up here in Bethlehem Bible College, you're actually going out to the community as well?
Yes, we're going just tomorrow for Friday. We're going out. And sometimes we'll do that, or we'll do home visits. Like we'll have a clinic going on in our main clinic area, and then we'll send a small team out to do home visits for people who aren't well enough or aren't ambulatory and can't get to our clinic, and we'll go take care of them in their home.
Are you seeing different people in the community, Muslim people coming in, Christian people coming in?
Yes, surprisingly. We're seeing mostly Muslim people, but we are seeing quite a few Christians as well. So it's nice. We like to get to do that. We like to encourage believers in an area and support them and let them know God is here with you, He loves you. And then we like to, of course, our heart is to reach the lost with the saving grace of Jesus and let them know there's a God who loves them.
Are people happy to see you when you come?
They are happy, and they are so joyful and so appreciative. I think they come in a little hesitant, not sure, but they're amazed at how much we have to offer. And then they get their medicine for free, so we actually give them the medicine when we're done. And then we always offer to pray for them. Most of them are happy to accept prayer. And then if they're not sure or they don't know who Jesus is, we ask if we're allowed to, if they would like us to share, and we get to share the whole gospel message with them.
Is the prayer just as important as the practical medical part?
Oh, I think the prayer is probably more important because a lot of the medicines we're given are short-term. We're not going to have a long-term fix for their chronic problems, but just knowing that someone cares enough to come see them is so helpful for their spirit. But the prayer will last forever. And we are trying to do more public health teaching, where instead of just giving them a medicine, we're educating them about their illness and how they can help themselves. For instance, we are seeing a ton of back pain, which is the world around a chronic problem. But we're showing them stretching and strengthening exercises if they need it. We're sending them to physical therapy, which we have here, just to teach them what things they can do at home long after we're gone to help their problem.
Now you have dentists here. Are Palestinians good at brushing their teeth?
No, of course, that's the world around too. You know, it's hard. You know, when you don't have access to regular clean water, sometimes it's hard. And we've cleaned teeth here. We had a 60-year-old couple who'd never had their teeth cleaned their whole life. Wow. And it took her a long time. So a lot of people don't have good oral hygiene, and for reasons, especially refugees in tent camps and water sparse, you know, it can be a lot harder. You know, we take so much for granted, the things we have that are easy, like access to a shower or a sink to wash our face and brush our teeth, that a lot of people don't have every day.
You've been here a number of days. Has it been successful?
Oh, it's been very successful. The first day we were a little slow, which often happens on a first-time trip to a new area where they've never heard of GHO. But as word gets out that we're here and that we're offering free health care and free medicine, it grows every day. And so, yeah, it's been a great trip. We've been really busy, which is what we want to be. We didn't come here to sit back and talk. We came here to work and serve. So we try to be the hands and feet of Jesus through health care, which makes them more open to hearing the gospel message.
Have you been to Bethlehem before? Is this your first time in Bethlehem?
I've been on a tour, an Israel tour, where we came to Bethlehem for like 2 or 3 hours in the afternoon. But so the first time really getting to live in it and see the culture and get to know some of the Palestinians better.
So this is the first time doing a medical tour here?
Yes, first time GHO's ever been here. So it's been great. We've loved it. We've loved caring for the patients. They've been so grateful. The national team here at the Bible College have been wonderful to work with. They've worked very hard. They're going to be exhausted when we leave and ready for a rest.
What other countries do you work in?
We work all over the world, so we work in multiple countries in Africa. We're going to Romania. We go to Indonesia, Cambodia, and then we do all of Central America pretty much, and a couple countries in South America. So quite a few, up to 25 different countries. So we send about 50 teams a year. So we're all over the world. Everywhere is different, but in the end, everywhere is the same too. People are like the world around. We think we're all so different, but we all have the same hopes and fears and dreams for our children and things like that, and just want to be able to take care of our families.
And where do you work in America?
I work in Tennessee. I'm an emergency medicine physician.
So have you taken time off specifically to come here and given your time for free?
Yes.
And many other of the group as well?
Yes, not only do we take time off from our jobs at home, but we pay to come. So we pay for our hotel and our food, we pay for our own airfare, and we pay for the medicine that we bring in. Our trip fees cover all of that. So we've bought everything that we're giving away to people as well.
How satisfying is it coming to somewhere like Bethlehem and helping the people?
It's wonderful. It's nice to practice medicine where you can do more holistic care and really take care of their body, their mind, and their spirit. Just love on them every way we can and teach them of an eternal healing, not just a physical healing here on earth, but eternity in heaven. So it's wonderful to serve. My faith has grown exponentially when I began serving. So I had a lot of Bible knowledge, but until I stepped out into an uncomfortable country I didn't know, and a language I didn't know, culture I didn't know, and served, trusting God could use me, and not only use me, but work in me as well as through me. It's been a wonderful experience. I encourage anyone, wherever you are, to try serving someone else.
Are all the team Christians, and do you know them before you come, or when you get here you start to meet different people?
Well, most of the time, every trip's different, every team's different, so we don't know each other. We're from all over the United States. So there's some we've never met. In fact, we have matching shirts we wear in the airport on the way here so we can find other team members. And then as you've done more and more trips, you get to know people and you'll meet them again on another trip somewhere. So that's what's fun about it, is just getting to meet other people. And not only that, but in other countries. So the body of Christ, it grows the more you travel and serve. Like I met a pastor in Ethiopia who prays for me wherever I go. And with social media, it's helpful to be connected with Facebook and that sort of thing, and you can message. So, people around the world are praying for the people here in Palestine because we're on this mission.
Yeah. How did you become a Christian?
I became a Christian more as an adult. I was raised Catholic, but we didn't go to church regularly, so really I think I was unchurched. But then when I had a child, and I realized I knew I was missing something. And so I just began searching and reading the Bible and taking some Bible study classes and then going on retreats and learning more about what it meant to be a Christian. And the Lord just spoke to me, and I've been a wholehearted follower of Jesus ever since.
Did God call you to be a doctor?
God called me to be a doctor. I remember praying because I was really struggling at the beginning of medical school, and I didn't know if I was going to be able to do it. And I said, you know what, God, I'm just going to do my part and study. You're going to have to make me a doctor if that's truly what you want me to be. So He is the reason I'm a doctor, and He knows my heart. I love to travel and serve, and He's given me this amazing job because now I left emergency medicine to become the director of global health outreach. So I manage all the trips we send all over. I don't go on all of them, and I don't lead all of them, but I'm in charge of managing all of them. But it's been, to me, being a Christian is like flying by the seat of your pants exciting. It's not rule following and checking off a box on Sunday morning.
And of course, being a doctor, you can go anywhere in the world and you'll be welcomed because you have a talent and ability that God has given you.
It's amazing what being a doctor can do. It opens the doors because you immediately are having an intimate conversation and asking things you would never ask somebody if you weren't a doctor trying to figure out what their medical problem is. So it creates this immediate intimate relationship where it opens doors to sharing the gospel that's wonderful.
Are you making a difference?
Absolutely, I think we're making a difference. Even just the fact that we love and care for these people and are praying for them, I think is enough of a difference. But then the medical treatment they receive will last them a lifetime of remembering that someone cared enough to come and take care of them.
What's your prayer for Bethlehem today?
My prayer for Bethlehem is that more people would come to know Jesus, that this would have a ripple effect, that people would hear about us and wonder, gee, why were they here? Why were they doing that for free? And it'll open doors for other people to say, because of Jesus.
Do you have any plans to come back again? You wanting to come back again?
Absolutely. We're already talking about we'll probably come back next year, because we really do like to make this connection with national teams and then develop those relationships and support and encourage them. And, people travel and move around, and there will be people here next year that we've never seen. So we love to be able to come back to Bethlehem.
Okay, Trish, thank you very much.
Oh, thank you so much. I really enjoyed talking with you.